How do you prepare for a liver biopsy? The way you prepare for a liver biopsy is the same way you successfully deal with the fear in your mind. Before your liver biopsy, you'll meet with your doctor to talk about what to expect during the biopsy. This is a good time to ask questions about the procedure and make sure you understand the risks and benefits. Stop taking certain medications to prepare for a liver biopsy. When you meet with your doctor, bring a list of all medications you take, including over-the-counter medications, vitamins and herbal supplements. Before your liver biopsy, you'll likely be asked to stop taking medications and supplements that can increase the risk of bleeding, such as aspirin, ibuprofen, Advil, Motrin IB, others, and certain other pain relievers. Blood-thinning medications, anticoagulants, such as warfarin, Coumadin. Certain dietary supplements that may increase risk of uncontrolled bleeding. Your doctor or nurse will let you know if you need to temporarily avoid any of your other medications. Undergo blood tests to prepare for a liver biopsy. Before your biopsy, you'll have a blood test to check your blood's ability to clot. When you have blood clotting problems, you may be given a medication before your biopsy to reduce the risk of bleeding. Stop eating and drinking before the procedure. You may be asked not to drink or eat for 6 to 8 hours before the liver biopsy. However, some people can eat a light breakfast. Prepare for your recovery. You may receive a sedative before your liver biopsy. If this is the case, arrange for someone to drive you home after the procedure. Have someone stay with you or check on you during the first night. In particular, many doctors recommend that people spend the first evening within an hour's driving distance of the hospital where the biopsy is done, in case a complication develops. What you can expect. What you can expect during your liver biopsy will depend on the type of procedure you'll undergo. A percutaneous liver biopsy is the most common type of liver biopsy, but however it isn't an option for everyone. Your doctor may recommend a different form of liver biopsy when you could have trouble holding still during the procedure. Have a history of or likelihood of bleeding problems or blood clotting disorders. Might have a tumor involving blood vessels in your liver. Have an abnormal amount of fluid in your abdomen, ascites. Are very obese. Have a liver infection. Before the procedure. A liver biopsy is done at a hospital or outpatient center. Also, you'll likely arrive early in the morning. Your health care team will review your medical history, including the medications you take. Just before your biopsy you will have an IV line placed, usually into a vein in your arm, so that you can be given medications if you need them. Also, possibly be given a sedative to help you relax during the procedure. On the other hand, use the toilet if needed because you'll need to remain in bed for a few hours after the procedure. During the procedure. The steps involved in liver biopsy vary according to the type. Percutaneous biopsy. To begin your procedure, your doctor will locate your liver by tapping on your abdomen or using ultrasound images. In certain situations, ultrasound might be used during the biopsy to guide the needle into your liver. You'll lie on your back and position your right hand above your head on the table. Your doctor will apply a numbing medication to the area where the needle will be inserted. The doctor then makes a small incision near the bottom of your rib cage on your right side and inserts the biopsy needle. The biopsy itself takes just a few seconds. When the needle passes quickly in and out of your liver, you'll be asked to hold your breath. Transjugular biopsy. You'll lie on your back on an X-ray table. Your doctor applies a numbing medication to one side of your neck. Then, your doctor makes a small incision and inserts a flexible plastic tube into your jugular vein. The tube is threaded down the jugular vein and into the large vein in your liver, hepatic vein. Next, your doctor injects a contrast dye into the tube and makes a series of X-ray images. The dye shows up on the images, allowing the doctor to see the hepatic vein. A biopsy needle is then threaded through the tube, and one or more liver samples are removed. The catheter is carefully removed, and the incision on your neck is covered with a bandage. Laparoscopic biopsy. During a laparoscopic biopsy, you'll likely receive general anesthetics. You'll be positioned on your back on an operating table and your doctor will make one or more small incisions in your abdomen. Special tools are inserted through the incisions, including a tiny video camera that projects images on a monitor in the operating room. The doctor uses the video images to guide the tools to the liver to remove tissue samples. The tools are removed and the incisions are closed with stitches. After the procedure. After the biopsy, you will feel some soreness where the needle was inserted, which may last as long as a week. Be taken to a recovery room, where a nurse will monitor your blood pressure, pulse and breathing. Rest quietly for 2 to 4 hours, or longer if you had a transjugular procedure. Have someone drive you home, since you won't be able to drive until the sedative wears off. Avoid lifting more than 10 to 15 pounds for 1 week. Be able to get back to your usual activities gradually over a period of a week. Results. Your liver tissue goes to a laboratory to be examined by a doctor who specializes in diagnosing disease pathologist. Then, the pathologist will look for signs of disease and damage to the liver. Next, your biopsy report should come back from the pathology lab within a few days to a week. At a follow-up visit, your doctor will explain the results. You may be diagnosed with a liver disease. Or your liver disease may be given a stage or grade number based on the severity, mild, moderate or severe. Therefore, your doctor will discuss what treatment, if any, you need. Reference: the free solution for fatty liver. Thank you. Reverse fatty liver, lose weight and improve your overall health and well-being, fast. Link in the description. Thanks for watching. Good health. Do not follow us, like, share, and comment with us.